Hi, this is Jill from Physio, and today I'm here with Michelle, and she's 4 months postpartum, and she's been coming into physical therapy to get her core strength back. One thing that I have her do to just see how the rectus, the six-pack muscle, is doing after having the baby is I'll have my patients palpate right about their belly button. So she's going to take one hand, find her belly button, and she's going to feel if there's a separation in there. And that's not uncommon to happen after you've gone through a pregnancy. The muscles and everything get stretched out. So this is a good little test to see if you've just had a baby. You can go ahead and try this at home. The other hand's going to come behind her head. She's going to feel in there, and then she's going to do a crunch. And then can you feel that separating a little bit?
Yeah.
So it's not uncommon to have anywhere from 1 to 4 finger widths of a separation in between that. It's called a diastasis recti. And Michelle loves high intensity training, so getting into the planks and the burpees and all of the really big movements. But what was happening was she wasn't getting that deep core stronger. So when she would try to do a crunch, her belly would pooch out a little bit instead of sucking in. So I had her start with one basic exercise called the Pelvic Tilt. So what she was going to do is go ahead and feel on each side here. Make sure you're feeling, this muscle is the seatbelt muscle. It's the transverse abdominis. So go ahead and flatten the back. And can you feel the muscles now? We've been working for about 4 to 5 weeks now in physical therapy. So now that she's been working really hard, she's getting the strength back in there. She's able to pull the belly button in and up towards the heart. So this is your basic exercise to get that core foundation going. If you can't contract those muscles, you don't have any reason to be going beyond this exercise. So then the next one that I would have her do would be go ahead and let's do the marching up. So just go ahead and contract, and you're going to lift one leg up at a time, up and down and up and down. And as she's doing that, really keeping in mind to pull in and up towards the heart instead of getting that separation. So it's a good idea to palpate in there, and self-palpation is really important. This is just one easy way to see where you're at postpartum, and Michelle's having a lot less pain, so she's pretty happy with that. If you or anyone you know is having issues with us, you can give us a call or look us up at prophysiomt.com.